I've now been joined by Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaji, and I've also been joined by a virologist at KCCR, Dr. Michael Owusu. We'll be speaking on the new measures announced by the President last night. Dr. Abuaji, I'm grateful for your time. Let me first find out, because we've had to deal with vaccine hesitancy since the start of the vaccination exercise. We have a target of 20 million Ghanaians to be vaccinated. Where are we now, and what does the easing of restriction mean for our vaccination?
All right. Thank you very much, and thanks for the opportunity to speak on this matter. Yeah, currently we have, I would say, roughly 13.6 or so million people vaccinated across the country. We have regional variation in the numbers, but what we have done is that the number of the regions with the highest prevalence also have the highest coverage of vaccination, and that's how it makes it a bit helping us to be able to take some of these decisions that we are making. Vaccine hesitancy is still a challenge, especially as we move into areas where the prevalence of the condition was not as high as before. But we are using all measures to encourage increased access for the vaccination uptake to increase. And that's why we are doing periodic campaigns to ensure that we mobilize more people to get a vaccine.
So what's the plan right now that the restrictions have been eased? Because if at the time we were having these restrictions, we're having challenges, and we are just 13 million, then it means that we have a long way to go. What's the plan going forward?
Well, the plan is what we've always done. The plan is a routine vaccination that continues to go on, I would say, daily basis in all our facilities. We are also doing periodic campaigns. We did one in December. We did one around February. That gave us about 2.1 million people vaccinated in 7 days. And next month, April, we'll do one. We are going to do 3 such events before end of June, just to boost the number of people who have access to vaccination. The new restrictions, the new easing of restrictions is going to mean that we need to encourage more people to look at it. If you look at the restrictions, vaccination is a requirement for most of the ease, and so we hope that that's another way of encouraging more people to take up the vaccine.
Is it still feasible to achieve our 20 million target?
Well, it is feasible. It is feasible, and it depends on the supply and the demand, and so it is feasible. We are pushing all strategies to ensure that people take. The last time we had about 2.1 million. If you can get 2 million in each cycle, apart from the routine daily vaccination, it should be feasible to get a 20 million jabs by the end of June.
By end of
June this year.
June this year. I'm grateful for your time. Dr. Patrick Kuma Abuaji, he is Director General of the Ghana Health Service. Now, preliminary findings by Parliament suggest that the Committee on Defense and Interior of Parliament have been speaking about the Boko crisis. We'll bring you all of that shortly after this break.